Hi, welcome to another episode of Unraveling the Knots, the podcast where we untangle more than just hair. Here, we explore the textured layers of care, culture, and connection that live within every curl and strand. We talk about how we care for our hair with love, intention, leaving you with a deeper understanding of your hair. I'm your host, Ganiat Salami, and I'm a lover of natural hair. Like, I love, love natural hair. I'm a project manager by day, beautypreneur by heart, and full-time natural hair enthusiast. This is where we pause, breathe, and lean into honest conversations about the hair we carry. I believe our hair tells a story and it deserves to be heard. Today's episode is one I've been eagerly looking forward to. We're getting into something more clinical, but still deeply personal to us all. It's a subject that's serious, but often overlooked. It is hair loss, and not any kind. We're talking about CCCA and traction alopecia. Now, these aren't just words or terms, they are real life struggles for so many Black women. And to help unpack them, I've invited someone whose knowledge is rooted in both science and care. She's someone who specializes in and is so passionate about skincare, but deeply understands hair loss, especially for Black women. She's the founder of So Skin Clinic, a place you can trust for advanced and tailored skincare treatment to elevate your natural beauty. Since the highlight of today's discussion will be centered on the scalp, Dr. Seyi Oni will be educating us on our roots. Oremi, I'm so glad to have you here. You're highly welcome. Can you please introduce yourself?
Thank you. So, like you said, my name is Dr. Seyi Oni. I'm a board-certified internal medicine physician, and I'm also a medical director of So Skin Clinic, located in Owings Mills, Maryland. I've taken an interest and passion in basically making sure that as people, especially women, we're comfortable in our skin. And so I've learned more about aesthetics. I've learned more about hair and ways to basically help individuals with issues in that regard, and, trying to find ways to rectify whatever those issues may be. And as you've highlighted, some things that have come up repeatedly in women I've met in the clinic is hair loss, and most notably CCCA and traction alopecia.
So, Seyi went the professional route. This girl is my friend from college. How many years have I known you again?
Oh my God. Over a decade. Is it 2 decades? 15 years? 17 years?
I'm trying to remember. I think.
Oh my God.
We've known each other since 2006. Almost 20 years.
Almost 20 years.
Yeah.
Wow.
Almost 20 years. See her forming serious doctor. I beg. So myself and Seyi went to university together. I remember meeting her. I know, right? Terp. I remember meeting her. I don't even remember how we met, but what I recall about Seyi is that she's such a warm and friendly person. She is like one of the nicest people I know. She is so down to earth. She's that kind of person that is like, she motivates your spirit, man. She just gingers you. That's Seyi for you. So please, minus all the work stuff, we'll still come back to it. Tell us more about yourself, Yes.
So yeah, we met in the hoods of University of Maryland College Park.
Hoods?
And getting to know you, very vibrant personality, very fun, very loving, very caring. So it was just, I think it was just meant to be that we ended up being friends. And you're one of the people that I kept in touch with after all these years, despite, you know how life gets when you get older, right? Life be lifing.
Yes.
But yeah, since that, oh my God, since those almost 20 years, I've since, I went on to med school, I got married, and I had 2 boys. And basically, they take up most of my time.
I'm sending you a hug.
I need it.
Wonderful.
I'll collect it.
Yes.
So hold on.
Thank you for the intro. We like getting to know our guests on more personal levels. So now let's transition to the questions.
All right, girl.
The main reason why we're here. So before we actually go deep into today's conversation about alopecia and CCCA, I wanted to first of all ask you, can we actually talk about your own hair journey? What is the earliest memory of your hair and how has it been for you personally?
So, funny enough, we've had several discussions about natural hair over the years. I don't know if you remember, Paul, but I would say, my earliest memories, I permed my hair very young, sometime in elementary school, but sometime after my prom, I was like, my hair is looking jacked. I'm tired of getting these perms. I'm going to go natural. So actually, before I started at University of Maryland, College Park, my freshman year, I cut off all my hair.
Wow.
And this was, yeah, this was before natural hair was popular. So people looked at me crazy.
Wow. Oremi was pioneer. When people were not team natural hair care movement, you already there.
I have stories.
Hey.
I have stories. And I was in this weird. So 2 months before we started in the fall, my hair grew out a little bit, enough to braid it. So I braided it when I got so my hair was in braids, and I kept it in braids basically all of freshman year. I remember I wore my hair out once beginning of spring semester, and I got comments like, oh my God, is that your hair? You cut your hair? There's no perm in your hair? These were the questions and I remember this one girl who, funny enough, who is natural now, even had dreads for a while, then removed them. But I remember distinctly, she was like, I could never wear my hair like that.
Goodness.
For her full chest.
Does she remember the conversation now?
She probably doesn't. I've had a lot of weird situations with natural hair because, again, it wasn't popular at the time.
Yeah.
I even had a situation where when I traveled to Nigeria for the first time, Africans were trying to touch my hair.
What? Wait, which year was this?
This was 2012 maybe, or 2011. I went to Nigeria for the first time. And by then my natural hair had grown out a lot. So I had big puff balls and, and people were like, is this this is your hair? And they called it virgin hair. It's like, this is your hair is virgin. I'm like, yes. And I remember my one aunt that I stayed with, God bless her, I love her. But she's like, she calls me Oluche, even though I'm not an Oluche. My name is different, but I accept it. And she's like, Oluche, here in Nigeria, we don't do virgin hair. So, me, I do virgin hair. I do virgin hair. And then the funny thing is, the second or third time I went back, it had exploded.
Can you imagine?
Everybody was doing natural hair. It wasn't a big, everybody was into it. And then they were into crochet braids and all this type of stuff. It was just a few years later.
Like 2-3 years later? That is so interesting.
I even had a conversation with my close family and friends, how they had told me it was unprofessional that I had gone to an interview, a job interview with my natural, that day out, I still remember it. It was like bullets to my chest when they were talking like, no, what are you saying? Stop, arguing with people like, no, it's not professional. It's not professional. It's not. I'm like, this is my natural hair growing out my scalp. It is combed. It is, maintained. There's nothing unprofessional about that. I'm sorry. I'm
Oh my
sorry.
God.
Yeah.
I think for a lot of us that move, that decided to transition to natural hair,
Mm-hmm.
we did it after the wave of people embracing natural hair.
Yeah.
So
Yeah.
to hear your story, you were one of those people that decided you loved your hair regardless of the height. You took
Yeah.
that bold step and you faced so much
Mhm.
from, oh my goodness.
It was a weird space. It was a weird space. Sometimes you even think like, is this the Twilight Zone? Why are people like, I didn't see the big deal in it. That's the thing. I did not understand the big deal. I did not get it. Did
Oh
not get,
my
and now
God.
it's even the people I had the conversation with that at that dinner party who told me that my hair being natural was unprofessional. They wear their natural hair now to work, and they are in the corporate world. So
What?
things evolve, things change, and I'm happy it changed this way because, to be honest with you, that type of mentality is brainwashing. Happy,
It is.
it's
But
like a
hold
colonial
on, hold on.
mentality.
Sorry. You know, I'm a bit um spiteful. Did you ever go back and tell them I told you so?
The only one person I kind of said, I'm just happy you're thinking this is my blood sister. That's the only one because she didn't understand how much I was being pained. I was like, we grew up in the same household. Why are you thinking? And the only difference is because we grew up in a predominantly Black neighborhood. She
Yeah.
ended up going to a HBCU. I ended up
Oh.
going to College Park. And I think at that HBCU, especially then, they had guidelines of what they say is proper. And I
Mm.
think that really stuck with her at that moment. And in my mind, I'm like, who are you to tell me that this is, but we're kind of, I don't want to branch off too much, but
Yes, yes, yes.
I'm the type of person also that they talk about like, dining etiquette. Who's etiquette? Do
You're
you
the
get
one now. Yeah.
like, this is not the proper way to hold a wine glass. The purpose of that cup to me is to drink what's in that cup. Do you get? That's the purpose. So I don't care in what queen's time they say you're supposed to hold your cup this way, hold your spoon this way, I could give a blessed F.
My goodness.
You get?
Yeah, man.
Same thing with language. Oh, this is the proper way to talk. Broken English is the purpose of language is to communicate.
Mm.
You get?
Yeah.
So if you communicate in broken English or broken French, Creole, and I understand, then it's doing what it needs to do.
My dear, you're like inspiring us right now with so much wisdom. And it's true. We get caught up in what people or society has said is proper or we're
Exactly.
supposed to do. We even came up with these rules
Thank
first
you.
and foremost. And for me, what I typically find is that when people get so engrossed in these expectations, it takes so much from you. It's not that we're saying you shouldn't do things in a way that is thoughtful or
Thank you.
deliberate or
Thank
intentional. But this whole thing of somebody wrote some rule somewhere that you have to do something this way, and it just feels like you are depriving yourself from that sense of authenticity to just be you.
Thank you. And on top of that, the people who came up with those rules and regulations are the same people that oppressed.
Mm.
Do you get? So you're taking on your oppressors' culture,
Yep,
basically.
yep.
Nigerians can eat with their hand, right? They can
Yeah,
eat with a spoon, but it should be an option. It should be a choice. It shouldn't be like, this is the only way. This is the quote unquote proper way, right?
yeah,
That's,
exactly.
that's my only thing. That's all.
Exactly. Oh my God, Shay, you started with a bang bang. I just said, Omo, give me your earliest hair memory. Shay, you
I
went
know.
to analysis.
Ah,
Love
girl.
you, girl. Love you.
Yeah.
Let me
Yeah.
not see. We can talk more. I think I even need to bring you back on this show for us to have these conversations about authenticity. I'm serious. So
Okay.
allow me. I know your
Okay.
schedule is like mad crazy as a doctor and whatnot, but I need to bring you back.
Oh,
Okay.
Allah. We'll sort it. Yeah.
She, my friend. Thank you. So, yes, now let's get into the meats of
Okay.
today's matter.
Okay.
Can you tell us what exactly is CCCA and how it is different from other forms of hair loss?
So Hair loss, the medical term for hair loss is alopecia. And there are so many types of alopecia. It's ridiculous, okay? But
Like how many? What's the
oh
range?
God, there's so many subsets. I don't want to misspeak, but there has to be at least 12, if not
Oh,
more.
wow.
Yeah. So there's so many forms of alopecia.
Okay.
And one way you can look at it is scarring versus non-scarring. And so for CCCA, it's basically central or concentric centrifugal cicatricial alopecia. And that cicatricial means scarring. So the whole thing would be like, if you say central or centrifugal, it involves the center or the crown of your head. It basically describes the condition, right? And then
Okay.
it says centrifugal. So the alopecia or the hair loss spreads evenly, but through the center, right? Does that make sense? So it spreads
Yes.
equally throughout the crown of your head. And then again, like I said, cicatricial means scarring. So it's a scarring. And then alopecia is just hair loss. So CCCA,
Yeah.
that's what that stands for.
So that's interesting. What actually causes that, um, I guess the scarring to happen in a uniform manner, like starting from the center is so
Mhm.
fascinating.
Yeah, that's how, and that's what, there's so many ways that alopecia occurs, even scarring alopecia. And after several case studies, they noticed this pattern because that's, with medicine, you notice a pattern and
Mhm.
then you can create a diagnosis, right?
Yeah.
So we're not too sure why it happens like that. There are a lot of dermatologists who have dedicated their lives to this issue. Some of them, especially Black women, even deal with it, but it's like a specialty on it. So not all dermatologists will know this, the very minute specifics. But overall, the general presentation, it starts in the center of the crown, it spreads and it scars, leads to, it has fibrosis and it leads to hair loss.
Wow. Okay. That's interesting. I'm not even going to try to pronounce the full meaning of
It's a
CCC.
mouthful. It's
I
a
can't try
mouthful.
it. My
Yeah.
next question for you is, have you ever experienced any form of hair loss yourself or maybe someone close to you?
Both. At this point, as Black women, um, I feel like you can probably out of a group of friends, you can probably name at least one. So even me, I've experienced traction alopecia and postpartum shedding, which is more of a temporary type of hair loss. But yeah, traction alopecia is one that I personally have experienced, and I know family members that have also experienced CCCA.
Oh, wow. Okay.
Mhm.
And it's actually interesting. I'm glad you highlighted traction alopecia. I'm not saying because you experienced it though.
Mhm.
But we tend to hear it a lot, right, within an African
Mhm.
community.
Mhm.
So, but what actually causes it? Um,
Okay.
what I've heard typically is that when you make your hair
Mhm.
and it's done too tight, is that
Mhm.
the only reason? Is that the only cause of traction alopecia? Or are there other causes?
So traction alopecia is a hair loss that is acquired, um, and it is a result of either prolonged or repetitive um, tension of the scalp and hair.
By
Okay.
acquired, you mean you actually
Caused.
it's
Like it's
caused.
not
Okay.
versus CCCA, right? There
Yeah.
are some theories which we can discuss later about the cause of CCCA, but there's no one definitive thing that you can say, okay, this caused CCCA, right? And it's not, and we're not sure for CCCA if there's a genetic component or not. For traction alopecia, there's no genetic component.
Hmm.
Okay, so it is acquired from outwardly things. And for the most part, it is purely either, again, repetitive tension or prolonged retention. And so, yeah, things like ponytails, chiffon buns, heavy hairstyles,
Yeah.
so heavy dreadlocks or long sister locks. Those type of things can cause traction alopecia. And surprisingly, also chemical treatment, so like what do you call it? Straighteners or perms, we say in the
Yeah.
African American community.
Really?
Those can cause traction alopecia as well.
How? Is it by like applying it on your scalp
So basically,
or?
it how do you say it weakens the hair follicles,
Ah,
right? And
yeah,
then increases the risk of it failing due to increased tension.
I see. I see.
It compromises the hair. It
Okay.
compromises the hair, the scalp, increases the risk of traction alopecia.
Wow, that's interesting. I think
Mm-hmm.
most people, when they're relaxing their hair, well, most people that are well informed about relaxing their hair these days, it seems like they tend to avoid their scalp. So does that prevent them from being affected by traction alopecia?
That's a good thing that they're trying to avoid their scalp. So, okay, I didn't want to cause confusion, but some of the same risk factors for traction alopecia are also risk factors for CCCA.
Okay.
Okay.
Yeah.
And that's why maybe you see the same demographics in both generally. But interestingly enough, like you can see like Sikhs, right? They have this
Yes.
tight head wrap, right?
Yes. Yes.
Right?
Yes.
They also experience traction alopecia. Why? Because of that repetitive tension that they put around the edges of their scalp.
So
Okay,
like
so that's another way you can get it.
that's interesting.
Mm-hmm.
So like the people of the Sikh faith
Mm-hmm.
using the head wraps usually
Mm-hmm.
affects them and increases their chances of getting traction alopecia. So
Mm-hmm.
now let's make another connection.
Okay.
So women in Nigeria that wear gilly
If it's too tight.
consistently.
Consistently tight. Mm-hmm.
Oh my goodness. So
Mm-hmm.
wearing gilly consistently too tight also
Too tight. Yep.
increases your chances
Mm-hmm.
of getting traction alopecia. Wow. Okay.
Women in the military,
Oh yeah.
ballet dancers, those
Mhm.
tight buns.
Yes.
Same thing. The only thing, so it can be very appreciable in the African American, people of African ancestry, right?
Yeah.
In that population, because our hair textures are a little different. It doesn't lay soft. So when you have traction alopecia, you have more of this, more baby hair than terminal hairs, right? Terminal hairs are the normal, long, thick hairs, right?
Yes.
And for African Americans, it can be tight coils that you might see, or it might just be clean versus, people of European descent, it may be soft baby hairs, fine, that lay flat. And so it's not as striking,
Hmm.
but they can also suffer from traction alopecia. Most
Wow.
definitely.
My
Most
goodness.
definitely. Yeah.
That's interesting stuff. Okay.
Okay.
My next question for you is, can you enlighten us on the early warning signs of these conditions? And how can someone know it's not just shedding or breakage?
Okay. So this is a little tricky, but I will say, let's look at CCCA first. So for CCCA, it's an inflammatory process. Okay.
Mm.
So first, you might notice excessive shedding more than you would expect. You may also experience maybe some pain.
Can I quickly interject?
Yes.
What, please, our audience, we're not doctors, not
Okay. Okay. Yes.
us.
Okay.
Please, what do you mean by inflammatory process?
Okay. So inflammation, especially in the functional medicine world, you hear it a lot. But what
Yes.
we've learned overall, we have a lot of inflammation, irritation in our body in general,
Mhm.
right? So with inflammation, you can also get some swelling, you can get redness, and it can happen in any part of your body. With CCCA, it can happen in your scalp.
I see.
With other conditions, Oh God. Trying to think of one now. There's some autoimmune conditions that cause inflammation in the body. The exact cause we still don't know, just like with CCCA, but that type of irritation in the body then can lead to what we call scarring, fibrosis. Okay. And because this condition is involving the scalp, that's where you get those findings. And so with that, you can get pain, you can get itching, you can get redness, you can get excessive shedding that's not making sense. Like you've never experienced this type of shedding before in your life, right?
Yeah.
So those type of things can occur. And those can be early warning signs that you're experiencing CCCA, basically.
Okay. So, just to clarify, my understanding is that typically we lose about 50 to 100 strands of hair a day, right?
Mm-hmm.
So, if it seems like you're losing way more, then you should be worried. That could be an early sign of these
You got it.
conditions.
You
Okay.
got it.
Okay.
Or if you're getting like excessive itchiness, and especially so
Mm.
for women of African ancestry that are listening now, if you start to experience some weird stinging or pain sensation at the crown of your head and you don't know why, that is also a red sign or alarming sign, right? If you
Yeah.
start to experience a lot of itchiness at the crown of your head and you don't know why, that is also a concerning sign. Or if you start to experience if someone's walking past and like, she it's looking like the top of your head is a little bit more see-through. What's going on? That is also, a warning sign.
Okay. Okay. Okay.
Mm-hmm.
Wow. That's really eye-opening. Okay.
Yeah. And then for traction alopecia, it could be, again, you might see like more shedding than usual, maybe some pain from the tension.
Yes.
And then the other things that we do in the aesthetic world and the dermatology world is, especially dermatologists, they'll have like a dermoscope. So it's like a handheld microscope for the skin, the scalp. They can also make diagnosis, and hopefully, depending if you start to experience those symptoms and you go to a dermatologist, they have a dermoscope, they'll look for certain findings under that dermoscope to say, okay, this is traction alopecia or this is CCCA, right? And yeah.
Okay, so I just wanted to ask another I wanted to ask another quick clarifying question.
Okay.
For traction alopecia, that usually happens around the edges. CCCA can happen anywhere on the head, or is it
It
usually
usually
the
starts the
center?
crown.
The crown. Okay.
Starts at the crown and then spreads equally outward so it can go all the way to the front.
It radiates downwards. Interesting. Okay. Okay. Wow, that's wow. This is like a serious eye-opening conversation here.
Yeah.
My next question for you is now let's actually talk about the causes from tight hairstyles to genetics. What are the biggest triggers we should be aware of when it comes to, I guess, CCCA? We already talked about traction alopecia, right? But what are the biggest triggers for CCCA?
For CCCA, now, yes, I like the term triggers because cause is unclear. Okay.
Yeah.
So there's working diagnoses now. So it can be triggered from hair grooming habits, right? There's also thoughts that there might be a genetic component. So some type of like familiar reoccurrence. Okay. So maybe your grandmother had it. You may have it, that type of thing. Then there's also concerns for excessive heat, chemicals. What else? Traction again. So braiding, tight braids, that type of thing.
Okay.
And then there's also concern for stress, possibly, all because it is an inflammatory process. So a process which is irritating the scalp.
I see. Okay. Wow. Okay. Awesome. Did I just say awesome? No.
Mhm.
Please. Catch that. I see.
Yeah.
Hmm.
Yeah. Initially, though, I remember they were saying, in the past, they were saying, oh, it has to be Black hair products only. It has to, but that hasn't panned out. The cause is still not clear because, some people would get CCCA and may have never permed their hair in their life,
Oh, wow. Yeah.
But there are some people that there's maybe some type of inciting event. Maybe they went to the Dominicans, got a hair blowout, and they burnt their scalp.
Yeah.
And maybe it starts off as a little patch, and then maybe life stress, maybe, all types of things. It will heighten it and maybe open the door for CCA to come in.
Oh, wow.
Yeah, it's unfortunate. Yeah.
How about diet? Is diet one of like the possible
So
triggers?
that is also a possible trigger. There's discussions about anti-inflammatory foods versus inflammatory foods. I know people like to talk about gluten a lot, dairy products. So some people who do have the condition, they may try to have a restrictive diet just to see if there's any improvement in their hair loss. Some people report improvement, some people don't.
Oh, wow. Man,
Yeah.
this thing
So
is
again,
complicated as heck.
exactly, it's not, and that's medicine for you. There's
Yeah.
nothing truly clear cut.
Yeah. It goes to show, we were people of faith. You're a doctor, you're a doctor. You people
It,
do a lot, but
not
the
God.
ultimate creator.
Exactly. And not God. So,
Awesome.
mhm.
Okay, then. There's a lot of misinformation out here.
Mhm.
Can you tell us what are some common myths or misconceptions you hear about hair loss in Black women?
um, that's a layered topic, but I think that um okay, so sometimes because there's so many types of alopecia, some people can see someone and say, "Oh, that's CCCA,"
Mm.
because there are other alopecias that have a similar presentation, but when you go in with the dermoscope, that handheld microscope for the skin and the scalp,
Mm-hmm.
you'll see different things under that scope, and then it will say, "Oh, that will prove that this is not CCCA. This is something else." You
Oh,
know,
yeah.
and that is also medicine for you, and that's why there's so many categories for alopecia, right?
And that's why a lot of us are confused as hell out here.
Mm-hmm. Some of the treatments are similar and some are not. So, someone will say, "Oh, I got this prescription from my doctor. Let me give it to you
Ooh,
because you have hair loss," right?
yeah.
And they'll use it, and maybe the hair loss will even get worse. You get?
Yeah.
Yeah. So that's the risk and misconceptions. And the other is like traction alopecia. It usually involves the perimeter of the hair, but again, it can also involve the center, which can cause confusion because when you think of traction alopecia, you're thinking edges, you're not thinking of center, you're thinking center, you're thinking maybe CCCA, right?
Yeah.
But if you're constantly pulling on a tight knot at the center of your head, it may also cause traction, right? At the top center of your
Yes.
head, which can cause hair loss there.
Yes, I'm smiling because back in the day when I
Mhm.
was very unbothered about how I managed my hair, there was a time when I used to do this bantu knot and I would tighten the middle of my head.
Mhm.
And I remember there was one time like my around that area, it was close to the middle of my hair.
Mhm.
That part of my hair looked lighter in terms of density.
Mm.
And I remember I had to stop doing those
Thank
tight
God you
styles, and
stopped.
then it got better.
Thank God you stopped because the earlier you notice the situation and stop, the better. The reason
Mm-hmm.
for CCCA, fibrosis. When fibrosis sets in, the scarring becomes more permanent, right?
Mm. Yeah.
And less likely for new hair growth to come in. Okay.
Okay.
For traction alopecia, the earlier you stop, the less damage you do to the scalp, better chances of the scalp recovering.
Ah, okay.
If
Okay.
you continuously do it, no break, it's going to be damage upon damage upon damage upon damage to the point where the body's probably like, I'm tired. I'm tired. I've tried
cannot produce anything else here. We're done.
I've tried for you. And you keep cutting what is growing. You keep pulling what's growing. I can't come and die.
You keep uprooting it. What is it, Steph? So please, ladies, people, if
let your hair breathe.
God bless you. Let your hair breathe. You need it.
Our scalps are tired. And girl, I love me braids. I love me some braids. But after my second kid, I played myself.
Oh, Lord.
I played myself. Within the first month, I went to a hair braider. I told her, don't braid tight too. Just leave the front for me. She braided tight. She chopped my hair. That thing took forever to grow back.
Yep.
Forever to grow back. And it paired with postpartum shedding. Exactly.
Bad combination.
Bad combination.
Goodness. So our listeners, please, let your hair and scalp breathe.
Yes, let it breathe.
Your scalp didn't come for war. Like that means that's what we say in Yoruba. Like, is life a battle? Like, your scalp shouldn't feel like life is a battle.
Girl,
let your scalp breathe.
Mm-hmm.
But, interesting. Mm-hmm. Okay. Now we've talked a lot about the causes of hair loss, in this case, traction alopecia and CCCA. When it comes to treatment, what are the medical and lifestyle options available? And how important is product choice in this journey?
Okay, so very important. So the first thing for both conditions is to try to stop and avoid any triggering or causative factors. So for CCCA, because it's such an open book and we're not too sure exactly what's causing it, stop the tight braids, stop any offensive chemicals.
List examples of offensive chemicals, please.
So anything that can cause irritation, and everybody's different. Some people can tolerate coconut oil, some people can't. Some people can tolerate, what's another one? I would stop perms, straighteners. Yeah, chemical relaxers. I would stop that. Tight braids, unfortunately, stop that. Cornrows, if they're tight, again, stop that. High heat. So those blow those nice little blowouts. Yeah. Stop that. Anything that can offend that scalp, you gotta stop it.
That's interesting. I've heard that. So, for example, when you're trying to deep condition your hair, it's recommended that you apply heat. And for me, for example, hair trans, it works. But in terms of directing it to our scalp, we should avoid that.
No. So usually when you steam, it's not the highest heat. High heat is like you go to the salon, you're going for a blowout. You know what I'm talking about?
Yeah.
Yeah. That's that high heat, that offensive heat. Right? Yeah. And on top of that, they're also using a tension method, right? They're using a comb, a paddle brush, something. So those type of things should be avoided. Heat, what's the other one? Steam. Those can be good, especially when you're trying to penetrate conditioners into the hair.
Yes.
Not bad.
Okay. So are there additional measures to take?
For CCCA, the other thing is, once you stop those things, you need to see a dermatologist, get an official diagnosis, of course. Once you have an official diagnosis, there are a few things that can be done. One is anti-inflammatories. Okay. So steroids, okay? There are topical steroids, so things you can put on the scalp. And then there's intralesional steroids. So you can get injections into the scalp. Okay, that may help. Then there's also platelet-rich plasma, PRP, or platelet-rich fibrin, PRF, that's been shown to maybe stimulate the scalp, to stimulate hair growth. So that's another thing you can do, PRP injections. Okay. There's maybe microneedling. Okay. But all those things should be considered only once you have a diagnosis and you're under direct care of a provider, because things can get tricky. Steroids, despite it being used a lot in dermatology, one possible side effect is hair loss.
Oh my goodness.
Yeah,
Yeah,
that's
you have to
you have to be in direct care of a provider. Okay. So
yes.
those things can be monitored.
So there's no DIYing your way out of CCCA.
No, you get your recommendations, and then hopefully if it's caught on time, okay. So basically the dermatologist can stage you. I think it's stages 0 to 5, 0 being no hair changes in the scalp, 5 being basically all they're seeing is fibrosis. Okay.
Yeah.
And the earlier the better. And then they can list off some treatments for you. There's also some other anti-inflammatories that are being tried now. But again, that would have to be prescribed by a physician, things like tacrolimus and things of that sort. And then the penultimate would be a hair transplant. Okay. You would have to be deemed a appropriate candidate. If you don't go to a dermatologist that you trust, there'll be some that will sell you a dream that won't work for you. You'll spend the money and it won't take.
Wow.
Okay. And then for traction alopecia, same thing, trying to avoid the offending factors, trying to avoid tight hairstyles, repetitive pulling, excessive heat, chemicals, like perms or things that may weaken your hair bonds. And then for traction alopecia, sorry, I forgot to mention for CCA as well, there's minoxidil, okay? There's oral and there's topical. There are side effects with these medications, okay? Especially with minoxidil. You can have heart palpitations, high blood pressure, of course, unwanted hair loss, especially with the systemic form, the pill form. So it's going to make your hair grow, but it might make your hair grow on your face, your chest, your arms, your legs, but it'll make your hair grow on your head too.
I'm so glad you brought it up, because I was actually going to ask you, how effective is minoxidil? Because it has become this hype medication for hairy growth. So it's good, but then it also has side effects.
And some people are very sensitive. Even with topicals, they'll have excessive hair growth in other places, just with topical use. Not everybody, but there are some people who will have excessive hair growth with topical use. And then there's some other agents. There's still a lot of research ongoing. Sometimes because, we have fungus that lives on our scalp, bacteria, just normal flora. But sometimes if there's concern that there's too much inflammation or irritation, we also give an antifungal, an antibiotic to try to reduce those loads on the skin, just in case that it might be contributing or impeding to the hair regrowth.
Oh, okay. Okay. Wow. This is fascinating. It feels like biology class all over again.
There's so many ways to pursue it. And again, I would say the people that have the best results are the ones that diagnose it early, that get it diagnosed early. The ones that wait and drag their feet or try to do their own concoctions and see, if they can grow their hair on their own. Unfortunately, time is scarring for CCCA, especially.
Wow. Goodness, that is both fascinating and scary at the same time. So please, if you are observing any one of these signs, go talk to a dermatologist. Okay. So now, for those currently struggling or scared, what gentle advice or encouragement would you offer to help them feel empowered in their hair journey?
I would say that the first thing is just to breathe and to acknowledge that everyone has their own story. You may be one that is currently just now experiencing some symptoms. You'll use this information as empowerment. to get on the ball and to get your concerns addressed. Then there might be some who unfortunately have a progressive type of alopecia and things aren't working and it's frustrating. You know, at the end of the day, it's just one part. And, you know, we can try our best and know that in medicine, we don't have all the answers. But you can also take encouragement in knowing that there's still ongoing research in these topics. So maybe one day there might be a better solution proposed. But for now, it's more so knowing that we're dealt our cards and we have to play what we got, the hand that we're dealt, right?
Yes.
And knowing that staying positive is the best way to go because our mindset does so much to our body. Right?
Yes.
So even when things are a little messed up or dark, we have to try our best to look at the positive and approach life that way. Because if we get taken up by the darkness, we're kind of beating up our bodies as well.
I keep hearing that there is a correlation between stress, being worried, and people's state of health. So it's great for a doctor to confirm it. And is this something you see frequently as a practitioner?
Yeah, there's a growing body of medicine now, actually, that talks about high levels of stress and what it does to the body. Also, we talked about inflammation. We think that high levels of stress cause inflammation in the body. And to what extent, we're still trying to figure that out, right? But stress can lead to high blood pressure. We call high blood pressure the silent killer, right?
Yep.
Overall stress can make the body just not function well. So again, when we're already dealing with so many things, the goal is not to add to it. The goal is not to add to the situation in which, you know, is causing us some stress. It's better to learn how to deal with that stress and, you know, reclaim your, not only your physical health, but your mental health.
Wow. There's no way anyone listening didn't feel more enlightened after all we've just heard from Dr. Seyi. That's it for this episode of Unraveling the Knots. A huge thank you to Seyi for taking time to share your wisdom and heart today. My dear, how can people listening find and connect with you?
Okay. So, as I mentioned in the beginning, I am into aesthetics at this time. If you're interested in getting some services, you can check out my IG page at SoSkin, or you can check out my website at soskinclinic.com.
Awesome. Thank you so much, Seyi. And if you're still with us at this point, we hope this conversation helped you feel seen, informed, and a little more connected to your hair. If you enjoyed this episode, why don't you go ahead and share it to your group chats, your besties, your social media platform, family, and friends. Get everyone to enjoy what you just enjoyed. You can always reach out to us on our socials, on Instagram at UTK Podcast, or email us at utkinhair@gmail.com. We so love hearing from you. Remember, your hair is yours to love, to care for, and to celebrate. Until next time, keep nourishing your roots inside and out. I'm Ganiyat Salami, and I'll catch you in the next episode.